desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
Yes.
I guess that's the one you got
That's,
from.
yeah, so
MIT.
no, that's great. I know
I'll be bringing in the speakers live this call.
Okay. I'm hearing some background
Hi, this is Natalie. Can I ask confirmation of the guest names? Is it Andrew Skolnick and David Long? I didn't know which number to give her. Oh, no. Sound like you were being
Yes, I had absolutely nothing. Yeah.
Is that okay? Thank you. Oh, I had absolutely nothing as well. And so I am looking forward to this little 30-minute break so I can get something to eat.
Yes.
So if you hear some growling, stomach growling, can you like get that out?
I said,
you pressing this button?
I put it back on. I thought it was just on my end. I'm sorry.
Yeah, be sure you don't touch any buttons back in the 100,000 people. So don't touch anything else besides the camera.
I'm looking for the word Maria. Okay. There we go.
Fun. I don't know if you're. Or it also All right.
Okay.
then
And one thing I'll note is that. Oh, sorry, Allison.
Go ahead. Nope, go ahead.
I just want to say that since we're going to do the test shortly, when we do that, all one thing you're going to be able to which is your cue that you are, well, simulating going live and
Right.
speaking. It'll be similar to the actual countdown. All right, so here we go. Simulating going live in 3, 2, 1.
Hold ended.
Hello, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you and thank you for joining us. Today, we're going to discuss how you can prepare to enroll in Medicare. Before we begin, if you would like to listen to this program in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Thank you for joining us today and participating in this teletown hall. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. Listeners, we will be sharing resources and phone numbers with you today, so you may want to grab a pen and paper to have handy. Let's get started. Today, we're joined by two guests. Andrew Sholnick, Government Affairs Director for AARP, and Xavier Vaughn, Advisor, Medicare Programs, AARP. Andrew and Xavier, so happy to have you both with us today.
Thank you for having me.
Thank you for having me as well.
Let's start with the basics. What exactly is Medicare? Xavier?
Medicare is a federal insurance program that provides health insurance for people aged 65 and older and for younger people who qualify because of a disability.
So is everyone eligible to enroll, or are there certain criteria you must meet?
Medicare eligibility isn't based on your income or assets, and you can't be denied coverage or charged more because of an existing medical condition. With Original Medicare, you can use any doctor or other provider in the United States that participates in the program. Most people over the age of 65 are eligible for Medicare. One exception to this rule involves U.S. citizenship. To be eligible for Medicare, you must be a U.S. citizen or permanent legal resident who lived in the United States for at least 5 years. A second exception has to do with payroll taxes. While you are eligible for Medicare, if you did not pay Medicare taxes during your working years, you will have to pay for the premium out of your own pocket.
Thank you for that important information, Andrew. Andrew, for those of us just starting out, what else can you tell us about Medicare?
I don't have a script in front of me, but I will just talk and make noise if you want to test the line. Yeah, I don't know a lot about Medicare. I'm not the expert, but on the call you will have someone who is. So thank you, Natalie.
Thank you, fake Andrew. I appreciate that. Now I'd like to bring in Julio Rios Villena. Did I say that correctly? Villena?
That is perfect. Yes.
to help facilitate your calls. Welcome, Julio.
Thanks, Natalie. Happy to be here.
Julio, let's take our first question.
Our first question is Adam from DC.
Hi, Adam from DC. What is your question?
Hi. Hi, thank you for taking my call today. I would like to know where I could get some additional resources.
Xavier, would you like to help Adam?
Yes. Hi, Adam. You can get additional resources on the AARP website. Also, if you need some in-person help, feel free to contact your local SHIP, which every state has a local SHIP that can provide free unbiased Medicare counseling.
And what does SHIP stand for?
SHIP stands for State Health Insurance Assistance Program.
Thank you.
You're welcome.
Julio, do we have another caller on the line?
We do not. That's all for sure.
Well, thank you for your time. We can go on back to the script unless is there anybody else I need to test? From the what?
From the what?
The what? Oh.
Okay.
Everything sounds good on our.
All right.
Okay.
That's great.
Sounds
We'll
good.
go and get us something to eat.
Yes.
So we won't hear our stomachs growl. Does the cafeteria take credit cards?
Yeah, they only take cards.
Oh, they only take. Oh, it's okay. That's fine. Great.
All right, let's meet up. I'm going to go
not hearing you on the stream, but I was hearing myself a little bit. It's very faint, so it's hard for me to hear. So I'm just going to speak a very loud test 1, 2, 3, 4, 5, and then stand by for another minute to make sure it doesn't come through. Okay, so here we go. Test 1, 2, 3, 4, 5. Standing by now. Okay. Test 1, 2, 3, 4, 5. Thank you, Hector. Allison, were you about to say something?
but that's my backup for the air, right?
Hector, can you hear me? So you'll go to one. Okay, so you drop the other one to the backup line. So it's just the backup line or just the main line? Let me know if you can still hear me. Say something. Talk to me. Here we go.
I can still hear it. It's very faint, but it's there. Our back end is still hearing. It's all of our back end, not just my voice.
Hello, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you and thank you for joining us. Today, we're going to discuss how you can prepare to enroll in Medicare. Before we begin, if you would like to listen to this program in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione *0 en su teléfono ahora.
Today, we are going to talk about how you can prepare to enroll in Medicare. We are also going to talk about what's new in 2023 and how you can get help paying for Medicare. We are connecting with thousands of AARP members from across the nation and will be joined shortly by thought leaders who will take your questions live. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being of older Americans for more than 60 years, and we are in your corner fighting on issues that matter to you and your family. If you have participated in one of our teletown halls before, you know this is similar to a radio talk show. Apologies. You know this is similar to a radio talk show. I lost my place, so forgive me. For those of us joining on the phone, if you would like to ask a Medicare-related question, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook, you can post your question in the comments. Hello. If you're just joining, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you to this important Medicare discussion, Medicare Prepare for Initial Enrollment. Thank you for joining us today and participating in this teletown hall. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. Listeners, we will be sharing resources and phone numbers with you today, so you may want to grab a pen and paper to have handy. Let's get started. Today, we're joined by two guests, Andrew Sholnick, Government Affairs Director for AARP, and Xavier Vaughn, Advisor Medicare Programs at AARP. Andrew and Xavier, so happy to have you both with us today.
Thank you for having us.
Thank you.
Now, let's explore some important things you may not know about Medicare, including how Medicare works, when and how to enroll, and what Medicare won't cover. Let's start with the basics. What exactly is Medicare? Xavier?
Medicare is a federal insurance program that provides health insurance for people aged 65 and older and for younger people who qualify because of a disability.
So is everyone eligible to enroll, or are there certain criteria you must meet?
Medicare eligibility isn't based on your income or assets, and you can't be denied coverage or charged more because of an existing medical condition. With Original Medicare, you can use any doctor or other provider in the United States that participates in the program. Most people over 65 are eligible for Medicare. One exception to this rule involves U.S. citizenship. To be eligible for Medicare, you must be a U.S. citizen or permanent legal resident who has lived in the United States for at least 5 years. A second exception has to do with payroll taxes. While you are eligible for Medicare if you did not pay Medicare taxes during your working years, you may have to pay for a premium out of your own pocket.
Thank you for that important information. Andrew, for those of us just starting out, what else can you tell us about Medicare?
Well, I know that Medicare can be a challenge and feel like a daunting task. But to make it easier, AARP has a great resource that I'd like to share. It's called the AARP Medicare Enrollment Guide. The AARP Medicare Enrollment Guide is an easy-to-understand tool with step-by-step directions on important items to consider when enrolling in Medicare for the first time. You can access the guide anytime at www.aarp.org/Medicare enrollment. Now, the first thing to know is that there are specific types of Medicare, parts rather. First, Medicare Part A covers inpatient hospital stays, skilled nursing facilities, hospice care, and some home health services. Medicare Part B covers outpatient services such as doctor visits, preventative care, and medical equipment. Medicare Part C, which is also known as Medicare Advantage, is an alternative to Original Medicare and includes all the benefits of Parts A and B, as well as some additional benefits, such as dental and vision care, perhaps. Medicare Advantage plans are offered by private insurance companies that are contracted by Medicare. And Medicare Part D covers prescription drug costs and is also offered by private insurance companies that are contracted by Medicare. Now, it's important to keep in mind that Parts A and B are often referred to as Original Medicare, and Part D is an optional prescription drug coverage. You may have also heard the term Medigap, which is supplemental insurance for Original Medicare, which helps pay for copays and out-of-pocket costs. You can research what's available in your area and select the option that best meets your needs.
Okay, thanks, Andrew. The Medicare Enrollment Guide sounds like a great resource. For our listeners, I want to repeat that website. You can find the Medicare Enrollment Guide at www.aarp.org/Medicare enrollment. Now, Xavier, let's say you're approaching 65 and ready to enroll. Will you get a letter or a phone call to let you know it's time?
Well, the answer is maybe, Natalie. No letter will arrive in the mail announcing it's time to start making these decisions unless you're already receiving Social Security. So if you are not, be aware that it is up to you to get ready and be prepared for enrollment.
Got it. So knowing that in many cases, it's our job to keep track of when to enroll, and how will we know when it's time?
There are different times you can enroll in Medicare. The initial enrollment period, or the IEP, is a 7-month period that goes from 3 months before the month in which you turn 65 until 3 months after. The general enrollment period runs from January 1st through March 31st of each year. Then there are special enrollment periods, or SEPs. If you don't enroll in Medicare when you turn 65 because you have job-based insurance, you get a special enrollment period for 8 months after you no longer have job-based insurance. You can only use this SEP either while you are covered by a job-based insurance or for 8 months after you no longer have that job-based insurance. Do remember that retiree health coverage and COBRA coverage are not the same as job-based health coverage.
So does that mean you can enroll during any of those enrollment periods?
As you approach 65, you want to decide on what the best time for you to enroll in Medicare. The timing might be different for different circumstances. For most people, it's better to enroll during the initial enrollment period, or IEP, because then you won't experience any gaps in your coverage. However, if you or your spouse are still working and you have job-based coverage, it's okay to keep that coverage for as long as you're employed. But if your employer has 20 or fewer employees, ask them whether your job-based insurance fully covers the cost of your services you get after you turn 65. If it doesn't, you might consider looking into enrolling into Medicare. Most importantly, don't wait for the general enrollment or for Social Security full retirement age or for the government to tell you it's time to sign up.
And what happens if you miss your initial enrollment period? Andrew?
Well, if you don't sign up during your initial enrollment period, you will get another chance to enroll during Medicare's annual general enrollment period. However, if you enroll at that time, your coverage starts the month after you enroll. And if you enrolled more than 12 months late, your monthly premiums for Medicare Part B, which covers your doctor visits and other outpatient services, will likely cost you more.
Thanks so much, Xavier and Andrew. We have a lot more to cover, but first, listeners, let's get to some of your questions about Medicare. To ask your question, just press *3. I'd now like to bring in Julio Rios Viena to help facilitate your calls. Welcome, Julio.
Thanks, Natalie. I'm happy to be here.
Julio, let's take our first question.
Yep, our first question comes from Facebook, and Gina is asking, I will be 65 in October, but I'm not planning to retire until June 2025. Do I need to sign up now to avoid penalties?
All right. Is that one for... Who would like to handle that one?
I can take a stab at that.
Okay.
So the answer kind of depends on whether you are still under your employer plan or if your spouse perhaps is still under the employer plan. If you have coverage through your spouse's work, as long as you're covered, you don't need to enroll. But if it sounds like you're retiring and planning to stop working and will no longer be under your employer-sponsored plan, then you need to sign up. But I think in your situation, since you're turning 65 first, but will continue to keep working, you don't need to sign up for Medicare until you stop working, and then you'll have a window of opportunity to enroll in what would be referred to as your special enrollment period in June of 2025, it sounds like. So as long as you're covered by your employer plan, you don't need to enroll just yet.
Thank you for that, Andrew. Julio, do we have another question?
Yes, our next question also comes from Facebook, and Woodrow asks, is enrollment in a Medicare Advantage plan automatic, or do I need to enroll directly with the plan?
Thank you, Woodrow, for your question. Xavier?
Yes, thank you. Enrollment into a Medicare Advantage plan is not automatic like it could be for original Medicare or Part A and Part B. So you will need to enroll directly with that plan. You can do that a couple of ways. You can do it through the plan website, or you can do that through Medicare.gov, or you can call either a Medicare or the plan to get enrolled that way. And also, if you need any assistance, the SHIPs, or the State Health Insurance Assistance Programs, which are located in every U.S. state and territory, are a great resource that can help you with that enrollment.
Thank you for that, Xavier. Julio, do we have another question?
Yes, we have another question from Facebook, and Kent asks, what is the best way to determine which Part D coverage is the least expensive?
Thank you, Kent, for your question. Xavier?
Yes, so if you log on and create a Medicare.gov account, if you can upload all of your prescriptions that you have, you can select a pharmacy that you would like to attend, and then you can then sort the plans in order from least expensive to most expensive. That way, and that will also include a monthly premium and your total drug cost for the year.
Thank you, Xavier.
Thank you.
Julio, do we have another one?
Yes, we do. Our next question comes from Sophie from Facebook. Sophie asks, in my first year of eligibility, if I choose an Advantage program, is it true that if I want to change to original Medicare the next year and get a supplemental plan, I have to apply for the supplemental plan and they don't have to accept me? But if I pick original the first year, all supplemental plans have to accept me.
Thank you, Sophie, for your question. Andrew, can you take that one?
Yes, that is true, actually. If you choose a Medicare Advantage plan when you first enroll in Medicare, you are not eligible for Medigap supplemental coverage. And then if you decide later to switch back to original Medicare and then choose to get supplemental coverage, the plans no longer have to offer you coverage, first of all, or they can charge you a different amount for it. So there are considerations when you're first enrolling in Medicare to consider what you need now and what you might need in the future as well, because there are differences between original Medicare and Medicare Advantage.
Thank you for that one, Andrew. Julio, do we have another one?
Natalie, it looks like that's all the questions we have for now. Actually, 1 second. We just received another question right here, and actually it comes from Facebook again. Eunice asks, is enrollment in a Medicare Advantage plan automatic, or do I need to enroll directly with the plan?
That's a good question, Eunice. Thank you for that. Xavier?
Yes, so enrollment into a Medicare Advantage plan is not automatic like it could be for Medicare Part A and Part B or original Medicare. So you would have to enroll directly with the plan.
Thank you very much. Julio, do we have another one?
Yes, we have another question here. Janice asks, I am in a dilemma. Why am I not getting notified about premium costs I have to pay?
Thank you for that question, Janice. Andrew, do you have an answer for her that could help?
Yes. Well, you should be receiving a notification from the Social Security Administration at least once a year. Social Security Administration handles Medicare enrollment, and if you're on Social Security, actually deducts the premium amount from your Social Security benefit automatically. So there should be a notification when you enroll and then each year thereafter. If you don't have that information, you can contact Medicare directly, probably at 1-800-MEDICARE, or the Social Security Administration, either online or on their phone number, which unfortunately I don't have handy at the moment. But you should be told at least annually what your obligations are for premiums.
Okay, thank you, Andrew. Julio, do we have any callers on the line?
Yes, we do. We have Vera calling from Georgia.
Hi, Vera, calling from Georgia. What is your question?
Yes, I wanted to know the date for open enrollment.
That's a good question. Xavier?
Yeah, so open enrollment is the same time every year, and that will be October 15th through December 7th.
You want to repeat those dates again?
Yes, same time every year, October 15th through December 7th.
Thank you so much for that. Julio, I think we have time for one more question.
That is correct, Natalie. Our next question also comes from Facebook, and Kim asks, I was told to apply to Medicare when I turn 65, regardless if I am still working and have coverage through my spouse's employment.
Thank you for that, Kim. Andrew, can you help her with that?
Sure. Well, in most instances, as long as you maintain coverage from your employer, you don't need to enroll in Medicare. You can, but you're not required to. There are, however, instances where there's small employers, usually it's 20 or fewer employees, like a small business, where the employer's plan can kind of encourage you or kind of push you on to Medicare, and then the employer coverage acts as a secondary payer. So there are instances, depending on the employer, and you would definitely want to talk to your employer about how their coverage works when you turn 65, whether you need to enroll in Medicare or whether it's just strongly recommended. So it is kind of depends on your situation. But for most people, you can maintain your employer coverage until you're ready to retire.
All right. Thank you, Julio, Andrew, and Xavier, for helping us to answer our callers' questions. We will get back to the phone lines in just a moment. Now we're going to change gears by talking about some of the choices you'll likely make during initial enrollment. Andrew, what should we start to think about?
Well, the first decision you need to make is between Original Medicare and Medicare Advantage, as I alluded to earlier. From there, you'll have other choices like supplemental coverage. Remember that original Medicare includes Parts A and B, and you'll probably also want to choose a Part D prescription drug plan. Medicare Advantage, or Part C, is sold by private insurance companies. Some areas of the country may have many plans to choose from, while others may have a few, if any. With Medigap supplemental coverage, you also have a choice of plans that are standardized and named with letters. Now, Medicare.gov is a good place to see what's available in your area and go through the menu of options.
Thank you, Andrew. Social Security is another topic that might be on your radar. Xavier, how does Social Security impact your Medicare decisions?
Yes, Social Security handles enrollment for Medicare Part A, which is hospital insurance, and Part B, which is medical insurance. If you are receiving Social Security retirement benefits when you are eligible to enroll for Medicare, the SSA will send you a Medicare enrollment packet at the start of your initial enrollment period. If you're receiving Social Security benefits on your 65th birthday, you'll automatically be enrolled in Part A and Part B. You have the right to opt out of Part B, but it might incur a penalty in the form of a permanently higher premium if you sign up for it later.
What if you haven't been receiving Social Security benefits? Where can you enroll in Medicare?
Yes, the Social Security Administration handles Medicare enrollment for Original Medicare if you're not currently collecting Social Security benefits. You can sign up for Medicare at your local Social Security office, online at ssa.gov/Medicare/sign/up, or by calling Social Security at 800-772-1213.
And Andrew, what if you're not sure Original Medicare is the right choice? How can you find out about other options?
That's a great question. The website Medicare.gov is a great first stop to learn about the program and different options. You can also contact Medicare directly by calling 800-Medicare. That's 800-633-4227, and you can talk to them for help. Also, each state has a state health insurance assistance program that are an excellent resource to get assistance. Now, Medicare Advantage, Medigap, and Part D prescription drug policies are sold directly by insurance companies. You'll need to enroll in Original Medicare first and then contact those companies directly for information and to enroll in them. And when deciding between Original Medicare and Medicare Advantage, it's important to know the differences between the two. With Original Medicare, you can choose any providers who accept Medicare. With Medicare Advantage, you will essentially be joining a private insurance plan, such as the one you may have had through your employer, and you may be restricted to in-network doctors and need referrals to see specialists. Under Original Medicare, you can access care anywhere in the United States if the provider accepts Medicare, while with Medicare Advantage plans are based around networks of providers that are usually self-contained in a specific geographic area. Also, with Original Medicare, you can get a wide variety of medical services, and with Medicare Advantage, you will get all the services you are eligible for under Original Medicare. And in addition, some Medicare Advantage plans offer care not covered by the original option, including some dental, vision, and hearing care. With Original Medicare, the federal government sets the premiums, deductibles, and coinsurance amounts. Medicare Advantage enrollees must still pay the government-set premiums, but most Medicare Advantage plans have set copay amounts. And often that means lower out-of-pocket costs than Original Medicare. Medicare Advantage plans also have an annual cap on out-of-pocket expenses, while Original Medicare does not. And again, if you can contact Medicare directly at 800-Medicare, that's 800-633-4227, or your local state health insurance assistance program, or SHIP for guidance.
Xavier mentioned premiums earlier. What other kinds of costs come with Medicare? Andrew?
Well, for Part A, there is no fee or premium for most beneficiaries. A small number of beneficiaries who didn't pay enough Medicare taxes during their working years must pay a $506 monthly premium. For Part B, there is a base monthly premium of $164.90 for 2023. Now, individuals with an annual income of more than $97,000 pay a higher premium. If you choose Medicare Advantage, there may be an additional premium cost, which varies by private insurer. For Part D prescription drug plans, the premiums vary by plan also. They average about $32.74 a month for 2023. And for Medigap, the amount varies by plan and the extent of coverage.
Are there deductibles and copays to consider?
Yes, there are those out-of-pocket costs as well. For Part A, the deductible for each hospital stay is $1,600 in 2023. The Part B deductible is $226 for this year. Medicare Advantage deductibles and copays vary by plan and by service. And Part D prescription drug plan deductibles also vary by plan, but they cannot exceed $505 for 2023. And Part D copays also vary by plan and by prescription drug. And finally, there's coinsurance. This is the share of the medical costs that you pay after you've reached your deductible. For Part A, there's no coinsurance fee for hospital stays of 60 days or less. For hospital stays of 61 to 90 days, it's $400 per day for 2023. For 91 days or more, it's $800 per day, or the full cost of the stay. Medicare also provides 60 lifetime reserve days that beneficiaries can use if they need to stay in a hospital for more than 90 days, but these can only be used once. Now, for most services covered under Part B, there's a 20% coinsurance on the Medicare-approved cost. Medigap policies typically cover Part A and Part B coinsurance. For Medicare Advantage, the coinsurance costs, again, vary by plan and by service.
Thank you, Andrew. So while costs may change each year for Medicare, is there anything else new in 2023 that we should know about? Xavier?
There are. Under the Inflation Reduction Act of 2022, the copays for many types of insulin have been capped at $35, and insured folks will not have to pay more, even if they have not met their Part D deductible. Also under the new law, vaccines that the CDC recommends for adults will be available to Medicare recipients with a prescription drug coverage free of charge, even if a beneficiary hasn't satisfied their Part D deductible. That includes shots for the flu, COVID-19, pneumonia, and others. Other vaccines, most notably the 2-dose Shingrix, which guards against shingles, are covered under Part D prescription drug plans, but may require cost sharing depending on the plan. Drug makers that market both Part D prescription drugs, those bought at pharmacies, and Part D drugs typically administered in doctors' offices, will face penalties if they increase prices more than the rate of inflation. Not only is this relief in place, but by September 1st of 2023, Medicare will begin negotiating prices with drug makers, which is predicted to have a huge impact on providing folks with affordable drugs. Negotiated prices for the first group of the 10 drugs will take effect in 2026. And there are news on the telehealth expansion made possible by COVID-19 pandemic, and it may change soon. Medicare officials were able to temporarily waive existing telehealth rules due to the coronavirus public health emergency. But now that the emergency declaration has lifted, many of those extra services are only scheduled to be available through 2024. Free at-home COVID-19 tests are also ended when the public health emergency ended, but COVID-19 vaccine will continue to be covered. Medicare expanded its access for older adults to behavior health and substance abuse services. The program has also improved access to licensed marriage and family therapists. Medicare paid for licensed clinical social worker, psychologists, and other behavioral health specialists to be part of a beneficiary primary care office visit. This means that folks can get all the care they need in one convenient visit. Medicare has expanded the type of medically necessary dental services it will cover when needed with other procedures, such as cleaning or other dental work, which will improve the outcome of an organ transplant or cancer treatment.
Thank you. That was a lot, but such good information for us all to have. I know this discussion continues to prompt caller questions, so we'll be getting back to the phones in just a minute. Please press *3 on your telephone keypad now or anytime during the call to be connected with AARP staff. Before we do, I want to remind listeners that in addition to sharing trustworthy information, AARP advocates for the issues that affect you most. To give a quick update on the fight for your health and benefits, I want to bring in Government Affairs Director Brendan Rose. Welcome, Brendan.
Great to be here, Natalie. Thank you.
This year, some important changes to Medicare took effect to help control the skyrocketing cost of prescription drugs. Can you talk about those?
Sure. Xavier just covered much of this, but after decades of calling on Congress to make prescription drugs more affordable, AARP won the fight to let Medicare negotiate lower drug prices and other policies that save seniors money on their medication. For example, the new law caps cost of Medicare-covered insulin at $35 a month, and it also eliminates out-of-pocket costs for most recommended vaccines under Medicare, such as the shingles vaccine. Also, drug makers will now be penalized if they increase prices faster than the rate of inflation. And beginning in 2025, there will be a limit on how much Medicare Part D plan beneficiaries pay out of pocket for their prescriptions, initially set at $2,000 a year. These are all changes AARP fought for and will save Medicare beneficiaries and taxpayers billions of dollars.
Thank you for that. Why is prescription drug reform such an important piece of Medicare advocacy?
Well, one of the things that we hear most from AARP members is the frustration and desperation that comes from trying to afford the skyrocketing prices of prescription drugs. The most common reason that older people skip medications or ration medicine is because they can't afford it. These cost savings will save lives and put money back in seniors' pockets at the same time they are struggling to afford the rising cost of medicines and other basic needs.
What other progress have you seen on the healthcare front?
Well, in recent years, AARP has succeeded in simplifying the enrollment process, holding providers accountable for the quality of care they deliver, and making sure that beneficiaries have access to at-home COVID tests. Also, for years, AARP advocated for access to more affordable hearing aids, and as a result, lower-cost hearing aids are now available for those with moderate hearing loss. Caregiving is another big priority for our members, and we're pleased that the White House recently issued an executive order offering sweeping support to family caregivers and long-term care workers.
That is great news. Finally, what are some other Medicare priorities AARP is fighting for?
Well, right now, Natalie, we're urging Congress to cover telehealth services so that more people with Medicare can keep getting care from the convenience of their home. We're also advocating for better mental health coverage and for Medicare to cover dental, hearing, and vision services so that every person can get the full range of care they need. And we're fighting for family caregivers and working to provide seniors with greater access to home care and more nursing home protection.
Glad to hear it. If listeners want to stay on top of AARP advocacy news, how can they find the latest updates?
Well, we encourage everyone on the line today to go to aarp.org/getinvolved, and that's all one word. And you can sign up for the AARP Advocate. This is a free monthly e-newsletter, and you'll also receive email alerts and the latest advocacy news. Once again, that's aarp.org/getinvolved, all one word, and that's an easy way for you to make a big difference.
Terrific, Brendan. Thank you for all that information. Thank you for joining us today.
Thanks for having me.
All right, Julio. Let's take a call.
Yes, our next caller is Patricia calling from Illinois.
Hi, Patricia from Illinois.
Hi. I was just calling to find out what is the difference in Medigap and the Advantage, the Medicare Advantage plan.
Thank you for your question. Let's give that to Xavier.
Yes, so Medicare Advantage plans are structured very similar to what your employer-based healthcare covers are going to be. You're going to have your HMOs, your PPOs. You're going to have to deal with in and out of network. You may need to have a referral to go to a specialist. You're going to have your out-of-pocket max that you can reach each year in your deductible. Your Medigap or a supplement plan does exactly what it suggests, right? It fills in the gaps or helps supplements your Medicare Part A and Part B. So it's going to help with your co-insurance and some of your deductibles with that. We know with Medicare Part B, you're going to have that 20% that you're responsible for paying. So it's going to help with that 20% that you have to pay.
Thank you for that, Xavier, and thank you for that, Patricia. All right, Julio, do we have another question?
Yes, we do. Our next question comes from Melba calling from California.
Hi, Melba, all the way in California. Welcome. What is your question? Melba?
It seems that we may have lost her, but I'll go ahead and read out her question since we had it on the queue here. So Melba asked, if you get Medicare early before 65 due to a disability, does it change when you turn 65?
That's a good question, Melba. Thank you for that. Andrew, can you take that one?
Sure. The short answer is no, it doesn't change. The Medicare benefit and program is consistent no matter what age you enroll in it. So if you are able to go on because of a disability before you turn 65, your coverage doesn't change unless you choose it to change during open enrollment, such as you want to get a Medicare Advantage plan or something else. So the program doesn't change underneath you.
Thank you for that. Julio, do we have another one?
Yes, we do. We have Denise calling from New Jersey.
Hi, Denise in Jersey. What is your question?
Hello. It kind of relates to what Melba's question was. Specifically, if my husband is on Medicare due to transplant, so it was a health issue that put him on Medicare to begin with, but he's still working, and then he turned 65 while the Medicare was still in progress, so he didn't have to enroll in Medicare at 65 because he was already on it. Is there anything specific he has to do when he decides to stop working, or does he miss out on that initial 65 of, not paying additional extra costs for enrolling?
Thank you for that question, Denise. Xavier, can you handle that one?
Yes. So since your husband is already enrolled in Medicare and receiving all his benefits, when he retires, he should be good to go.
Thank you for that.
You're welcome.
All right. Julio, who's next?
Yes, our next question comes from Facebook. Angela asks, I received a notice of creditable coverage through my employer for Medicare Part D. When I retire next year at 68, would this coverage prevent me from paying a penalty once I'm not receiving benefits from the company?
Thank you, Angela, for that question. Andrew, can you take that one?
Sure. So the answer to this is yes. As long as you have creditable coverage for prescription drugs, you will not have a penalty if you delay enrollment in a Part D plan. However, if you no longer get your employer coverage and you no longer have that creditable coverage, however long you go without it before enrolling in a Part D plan, the clock kind of starts at zero once you lose your coverage. So the notice of creditable coverage is good for that year. It says you have it now. But if you next year change and decide not to enroll in a Part D plan, the clock kind of resets. So you're good now, and then when it ends or you decide to retire, it'll be important to enroll in a Part D plan as soon as you're eligible, rather than wait.
Thank you for that. Julio, do we have another one?
Yes, our next caller is Bernice calling from Alabama.
Hi, Bernice in Alabama. What's your question?
Oh, yes. I'm sorry. I thought he had it on recording.
Oh.
My question is, I have Part A and I have Part B. However, I'm curious about D and what? C and D, because I'm a military spouse.
Okay.
So I get my medicine,
Uh-huh.
and I get whatever else I was listening to that you were saying. So how do I fit there? Is it necessary that I take that out, or just go on, leave it alone? Because I get those other things from TRICARE for Life.
Okay. Thank you. Xavier, can you handle that one?
Yes. So with TRICARE for Life, you have to be enrolled in Medicare Part A and Part B. But it is not necessary to be enrolled into a Part D plan to have your prescription drug coverage, since you are already getting that with TRICARE.
Okay. Thank you very much. Julio, do we have another one?
Yes, we do have one more here, and it's from Facebook. And Anne Marie asks, how does GoodRx work with Medicare prescription coverage?
Thank you for that question. Andrew, can you handle that one?
Sure, I can try, although I think Xavier might actually have some good insight into this
Oh,
one.
Xavier? I'm pitching it over to Xavier then.
Yes, I can take it from here, Andrew. So GoodRx is a great program that can help lower your prescription drug costs. And you can use that with your Medicare plan. But it's also very important to note that GoodRx does not take the place of your Part D plan or your Medicare Advantage plan, which you have prescription drug coverage through. It does not count as credible coverage. So it's really important that even if you want to use this plan, that you are still enrolled into a Part D or a Medicare Advantage plan to get your drug coverage, so you don't have any penalties further down the line.
Thank you for that. And if you would like to ask a question, please press *3 on your telephone keypad. Julio, do we have any other questions?
Yes, you do have one more question here from Facebook, and Letitia asks, I am a disabled military veteran. I only have the VA hospital for health care. I have Medicare and the drug prescription plan. Do I actually have to have Medicare?
That is a good question. Thank you, Letitia. Andrew, can you take that one?
Sure. So this is a little tricky, and I might need Xavier to back me up. But I think because you have VA coverage, you don't necessarily have to have Medicare, but it's highly recommended that you do. In fact, there's been an effort underway because of backlogs in the VA system to allow other doctors to see VA patients. And Medicare can act as a wraparound coverage or a secondary payer if you're outside the VA system. So you might not need like supplemental coverage, and you might not need a prescription drug plan, but it's probably a good idea to stick with Part A and Part B, depending on your benefits. I'll ask Xavier if I missed anything on that one, but I think you're probably fairly safe having both for the time being.
Yes, I think you are 100% correct.
All right, Julio, I think we have time for one more question.
We do. Our next question is actually Lynette calling from Ohio.
Hi, Lynette.
Hi.
What is your question?
Hi. I have Medicare Advantage, and it doesn't even come close to covering the dental that I need. I keep getting calls from people all the time saying that, there's all this extra stuff I could be getting. But my agent says that they're just trying to find out how much money I make. Now, is there something additional that I can get to cover my dental? Because I actually had one dentist tell me $54,000 out of pocket, which is, I'm not doing that. So Is there more dental coverage that I can get?
Thank you for that question, Lynette. Andrew, can you take that one?
Sure, I'd be happy to. Yeah, that's a good question. A lot of people are really surprised when they enroll in Medicare to realize that Medicare does not cover dental or hearing or vision for that matter. Some Medicare Advantage plans do offer some level of coverage, but it varies greatly by plan, and it's usually not that much. It can be just like a few $100s or maybe just a couple preventative cleanings a year. So there is a tremendous lack of dental coverage in Medicare, and that's one of the things that AARP has been fighting for a long time. Now, the options that you have available to you are, for better or worse, basically buying a standalone private plan from another company like Delta or Aetna, or a standalone offering that is just for dental coverage. So Medicare beneficiaries can buy these plans on their own. The premiums vary depending on how much coverage they offer. But for some major dental work, which can be very costly, they do provide a value. So it'd be something to look into, is buying a standalone dental coverage plan.
Thank you so much, Andrew and Xavier, and such great questions from our callers. Andrew, some of us might have concerns about being able to pay for everything. Are there dedicated resources available for people who need help paying for Medicare?
Sure, that's an important point, Natalie. Before we get too much further into the details of Medicare, let's talk about Medicaid. First, Medicaid is a jointly run program by federal and state governments, which means that eligibility requirements and coverage details can vary by state. Regardless of which state you're in, your income and financial assets must fall below certain levels in order for you to qualify for Medicaid. Many people with very low incomes are eligible for both Medicare and Medicaid. In all states, Medicaid provides coverage for some low-income people, families and children, pregnant women, the elderly, and people with disabilities. That means that Medicaid program will pay for all of your Medicare cost sharing, and you'll get access to benefits that Medicare doesn't cover, like nursing home care and transportation services. Some people whose income is not low enough for them to qualify for Medicaid may still be eligible for Medicare savings programs, or MSPs. These programs help pay for some or all of your share of Medicare costs, such as Part A and Part B deductibles, coinsurance, and co-payments if you meet certain conditions. You can check with your state Medicaid program to see if you qualify. There's also a program under Medicare Part D called Extra Help. This helps people with limited incomes pay for prescription drugs. Folks get extra help automatically if they have full Medicaid coverage, if they qualify for certain Medicare savings programs, or if they're receiving supplemental security income benefits from Social Security. It's administered by the Social Security Administration, and if you qualify for Medicare Part D Extra Help, you will pay less in drug plan premiums and co-payments or coinsurance. You can find out if you qualify by calling 800-633-4227 or checking online at medicare.gov. Also, the state pharmaceutical assistance programs, or SPAPs, are offered in some states to help eligible individuals pay for prescriptions. You can contact your SHIP at 1-877-839-2675 or on the web at shiphelp.org to learn if there's a state pharmaceutical assistance program in your state.
Thank you so much, Andrew. We have covered a lot of information today, so I'm going to review a few important points we discussed. Medicare is a federal insurance program that provides health insurance for people age 65 and older and for younger people who qualify because of a disability. Medicare eligibility isn't based on your income or assets, and you can't be denied coverage or charged more because of existing medical conditions. With Original Medicare, you can use any doctor or other provider in the United States that participates in the program. Medicare consists of Parts A, B, and D, as well as Medigap and Medicare Advantage programs. For many of us, no letter will arrive in the mail to tell you when to enroll, so be mindful of your upcoming enrollment once you turn 64. You won't be reminded to enroll. There are several enrollment periods, including the initial enrollment period, the general enrollment period, and the special enrollment period. Timing is everything. Your main choice when enrolling in Medicare will be between Original Medicare and Medicare Advantage. If you are receiving Social Security benefits when it's time to enroll in Medicare, Social Security will automatically enroll you in Parts A and B. You can opt out, but you might incur a penalty for enrolling later. And finally, you can enroll in Medicare at your local SSA Social Security Administration office online at ssa.gov or by calling the Medicare hotline at 800-633-4227. Now, Andrew and Xavier, do I have that correct?
Yes, you do.
Yep, thank you.
That was a lot. Excellent. Listeners, make sure you have that pen and paper handy as we'll repeat a few important phone numbers and web addresses shortly. But first, let's get back to our listeners' questions. Julio, who do we have on the line?
Yes, our next question comes from Facebook, and Denise asks, does Medicare begin on your actual birthday or on the first of the month of your birthday? For example, my 65th birthday is January 6th. Will I be covered on January 4th?
That is a great question, Denise. Xavier?
Yes, so if you are already enrolled into Medicare, if you are already receiving your Social Security benefits, or you did what you needed to do to enroll into Medicare by the time of your birthday, then that coverage will start on January 1st.
Thank you. Julio, we have another one.
Yes, our next caller is Pauline calling from New Jersey.
Hi, Pauline from Jersey.
Hi, how are you?
I'm great. What is your question?
I just wanted to know that if you're working into 65, the A plan is free. Do you have to apply for A, or can you wait till when you stop working and apply for A and B together all at once?
Thank you for that.
I went to the Social Security office and they told me that I didn't have to apply for B, but I could apply for A, or I should apply for A now. But because it's free, I should apply, but I don't have to. Is that true? Is that true?
Thank you for that question. Andrew, can you help Pauline?
Sure. That is true. They gave you correct information. You don't have to, I suppose, apply for Part A, but it's in your best interest, largely because you've already paid for it. Part A is financed through payroll taxes. There's no premium in Medicare Part A for most people because they've been paying into it their entire working lives. So once you turn 65 and are eligible, you can just enroll in Part A, and it doesn't really cost you anything if you're still under your employer coverage. The Part B, you can wait until you leave your job and no longer have the employer coverage to enroll in Part B, at which point you'll have a window, a time period to enroll without a penalty. So again, they gave you correct information. It would be in your best interest, most likely, to just enroll in Part A, even if you don't use it, and then you can wait on Part B until you're ready.
Thank you, Andrew. Julio, do we have another caller on the line?
Yes, our next caller is Lois calling from New Jersey.
Oh, look at all these New Jersey folks.
Yeah.
Hi, Lois. How are you?
Hi, I'm good. How are you?
Wonderful. What is your question?
My question is this. Is it better to go with the Medicare and a supplemental insurance, or go with the Advantage because, I mean, back with Medicare covers like 80%, so you have a supplemental. But with the Advantage, you would have you go with the card, you have the Advantage with the hopes of them paying for everything, I guess, is what I'm asking.
Oh, thank you so much. Xavier, can you handle that one?
Yes. So for every individual, this answer will be different. Just because it works for your neighbor, it may not work for you. If it works for even your spouse, it may not work for you. So some of the advantages and disadvantages of each would be with a supplemental plan, they really do cover a lot of your additional costs, right? So if you have a major surgery, your costs are going to be very minimal, if anything. With that being said, the monthly premium is going to be significantly higher than a Medicare Advantage monthly premium. A Medicare Advantage premium could be as low as $0 a month. With a Medicare Advantage, though, you are limited to dealing with a network, dealing with in and out network, whereas with a supplemental plan, you can just go to anywhere who accepts assignment or accepts Medicare. You also will have an out-of-pocket max. So that could be more than your monthly premiums, so it's really a balance of what you can afford, what your health status is right now, but also thinking into the future. So thinking about maybe your family health history and figuring out what would be the best plan for you to go with, and just kind of shopping around.
Thank you for that.
You're welcome.
Julio, do we have another question?
Yes, our next question comes from Facebook, and Viviana asks, if I have a high deductible health plan and HSA account, my understanding is we need to delay enrolling in Medicare. What need to do before enrolling?
Thank you for that question from Facebook. Andrew, can you handle that one?
Sure. We get questions a lot about high deductible health plans and HSAs and how they work with Medicare. So I think the advice would be that you should still consider enrolling in Medicare. What happens is if you have an HSA or a health savings account, you can no longer contribute to the HSA once you have Medicare, but you can still take from your account. So if you already have money in the HSA, you don't necessarily lose it. You can spend it that year or spend down that account. You just can't add new money to it. And the reason for this is because Medicare is not a high deductible health plan. It's actually very good comprehensive coverage with a fairly low deductible. A high deductible health plan typically has like a $5,000 or $10,000 deductible. Medicare, the Part B deductible is only a couple $100, and the Part A deductible is about $1,600 per hospital stay. So it's a much different deductible structure, and you don't need the health savings account for it. So they let you keep the HSA account, but you can't add new money to it. So it's really up to you how you proceed. But in most instances, the Medicare coverage will be the better coverage than the high deductible health plan.
Thank you for that. Julio, do we have another one?
Yes, our next question also comes from Facebook, and Cheryl asks, as a federal retiree, I have health care, Blue Cross Blue Shield. When I turn 65, that will be my secondary insurance, and Medicare will be my primary. Do I need to enroll in Part B?
Thank you for that question from Facebook. Andrew?
Probably you'll need to enroll in Part B. It would depend on the plan and the retiree benefits. If they're telling you that they're going to be their secondary payer, that means that they want Medicare to pay first, and then they will act largely as your supplemental coverage. They will pay for any unpaid costs that Medicare doesn't cover. So they kind of like work together, but they typically, like the Blue Cross plan, would want Medicare to pay first, and then they would pick up the rest. So they're probably asking you to, yes, enroll in Part B when you become eligible.
Thank you. Julio, I think we have time for one more question.
Yes, we do. We have Susan who's asking, please confirm, if you have coverage Medicare at 65, or does the SEP apply up to 8 months after least that coverage?
Thank you for that question. Were you able to hear that, Xavier?
If we could repeat that would be great.
The question was from Facebook. If you have coverage through a spouse's employer's insurance coverage, do you need to enroll in Medicare at 65, or does the SEP apply up to 8 months after losing that coverage? Xavier?
Yeah, so if you are covered through your spouse health insurance, you do not need to sign up for Medicare right at 65. But when he or she retires, you would then be eligible for the special enrollment period, or SEP, for up to 8 months afterwards.
Thank you for that. Thank you, Julio. And that is all great advice. You've already given us some great tips. But before we wrap up, I wanted to ask if either of you have any resources to remind our audience of. Xavier, let's start with you.
Great. I also would like to stress how great of a resource the AARP Medicare Enrollment Guide is. The tool provides you with access to videos and articles about Medicare essentials, the parts of Medicare, costs, and coverage. There's also an interactive tool called What's Right Plan for Me, which will help you compare options so you can make an informed decision. When you are ready to enroll, use the step-by-step how-to guide to assist you. Again, you can find this great resource at www.aarp.org/Medicare enrollment, or call AARP toll-free at 877-634-8213. You can also get a general information and menu of choices at Medicare.gov, or by calling the Medicare hotline at 800-633-4227 for general information on Medicaid at Medicaid.gov.
Thank you, Xavier. And Andrew?
Those were great resources. I'd also add, if you need more information on Social Security, you can visit ssa.gov or call 800-772-1213. And for additional guidance on Medicare in your state, you can contact the State Health Insurance Assistance Program, or SHIP, at 1-877-839-2675.
Listeners, thanks so much for joining us for this important discussion. Thank you so much, Xavier and Andrew and Brendan, for joining us, and thank you to the AARP members. We hope you learned something new today. Thank you, everyone, and have a great day. This concludes our call.